Good evening. Our today lecture series is on the application of electromagnetic fields in medicine. Electromagnetic fields are a combination of invisible electric and magnetic fields of force. They are generated by natural phenomena like the Earth's magnetic field, but also by human activities, mainly through the use of electricity. A combination of magnetic and RF fields are employed in diagnostic imaging. Applications involving heat generating RF waves are used for therapeutic purposes. The three main EMF applications in areas of medicine using EMF sources are MRI, RF ablation, localized dielectric heating. MRI in terms of diagnostic imaging, RF ablation, cardiology and cancer therapy. Localized dielectric heating, short wave diathermy. MRI is a medical imaging technique used in radiology to visualize internal structures. An MRI unit produces three different EMF fields to generate images. A static magnetic field of zero frequency, average magnetic flux density of 1.5 to 3 Tesla, produced by a large magnet for the alignment of hydrogen nuclei inside the body. MRI, low power time varying magnetic field gradients, whereas the frequency ranges between 100 Hz to 1 kHz, generated by small magnets in three orthogonal planes, provide the spatial position of the protons. Further, these MF gradients allow image slices to be created by focusing on the patient body part under examination. RF fields from 100 to 200 MHz produced in the non-radiative near field of the emitter to excite the protons and cause the protons to emit radio waves for the acquisition of anatomical images. Radio frequency ablation. These procedures in the medicine are mainly used in cardiology for the treatment of cardiac disorders and in oncology for tumor treatment. For interventional cardiology, RFA is a minimally invasive medical procedure used to correct irregular heart rhythms. The RF device consists of an ablator, RF generator and a control console. The energy emitting probe is at the tip of the catheter, which is inserted through very large veins into the heart. Ablation involves destroying small diseased parts of heart muscle by means of the resistive heat due to the electric current generated by high frequency RF waves. RF is also used to treat tumors in lung, liver, kidney and bone, but with the generator at a higher power than used for cardiology purposes. A needle-like RFA probe is placed inside the tumor. RF waves passing through the probe increase the temperature within the tumor tissue, resulting in its destruction. RFA may be combined with locally delivered chemotherapy treatment, and it is of particular value in reducing the size of inoperable tumors. RFA is minimally invasive and repeated procedures can be done with a few complications when performed under radiological guidance. The next one is Localized dielectric heating, shortwave diathermy. Shortwave diathermy is the therapeutic application of high frequency alternating current used in physiotherapy treatments. RF fields are used to speed up the healing of tissues by providing deep heat to a large area of the body positioned under conductance plates. Continuous shortwave diathermy is a technique of choice when heating of deep tissue is required. Diathermy allows superficial structures to be heated selectively by means of various surface heating techniques. Subacute or chronic conditions respond best to continuous shortwave diathermy. Diathermy is used to relieve pain and muscle spasm, resolve inflammation, reduce swelling, increase joint range and decrease joint stiffness. Measurements made of RF fields close to diathermy equipment show that for continuous wave shortwave equipment, recommended ICNRP whole body levels were exceeded 0.5 to 1 meter from electrodes and cables. This distance was reduced to 0.5 meters for microwave units and pulsed shortwave diathermy models. Electromagnets link medicine to robotics. Today, there are countless uses for electromagnets, such as the application of electromagnets in industrial robotics, which is closely linked to medicine. Electromagnets integrate median and robotic using the tools of a surgeon, such as an eye surgeon, who can extract steel pieces from a patient's eye with an electromagnet, increasing the current until he pulls enough to gently remove the metal. Also, in microsurgery, researchers are working on electromagnets that can move microrobots around the body to perform surgery without opening the patient. Electromagnets are devices that work because an electric current produces a magnetic field, and if a wire carrying a current is formed in a series of loops, the magnetic field can concentrate inside the loops. Hope you understood the major applications of electromagnetic fields in various domains of medicine. Thank you for listening. Thank you. Myself Dr. Vaniprabha, Associate Professor, EC Department, SNS College of Engineering. Thank you.